Our mission is to deliver accessible, affordable healthcare to millions of people in underserved emerging markets via the digital mobile network, generating a beneficial social impact in their communities. Good afternoon, everybody. My name is Robert Condon, and I'm a founder and CEO of the London-based health tech company Esprit Health. Today, I'd like to present mHealth, our platform for the delivery of primary healthcare to underserved global markets via the digital mobile network. Our mission is to deliver accessible, affordable healthcare to millions of people in underserved emerging markets via the digital mobile network, generating a beneficial social impact in their communities. Getting affordable access to essential healthcare and health insurance is something of a challenge in emerging markets, and people often need to travel considerable distances and endure lengthy waiting times to see a doctor. In many of these markets, there are less than 2 doctors per 10,000 population. So why now? Well, I spent the whole of my career in the global telco industry, and much of that time was spent building and operating mobile networks. Now, many of these networks were in emerging economies. The mobile network has leapfrogged the fixed telecom infrastructure in emerging economies, and the smartphone has become the de facto means of communication and access to the network. So my colleagues and I, having taken that experience of the mobile industry and seen the developments in the industry, particularly of late with the very successful mobile money, we are developing a platform, as I say, a digital mobile health platform and marketplace. This diagram shows ecosystem on the one hand, the healthcare marketplace on the left-hand side, and it's an ecosystem of physicians, suppliers, e-commerce, governments, NCOs, and distribution channels. And on the right-hand side is a diagram showing our platform, which shows the various primary and secondary healthcare services that we offer on the platform. Our unique digital healthcare wallet contains important information, including ID healthcare services, EHRs, insurance products, payments and claims, and vaccination passports, and a whole bunch of other things. Now, this is modeled on the financial wallet, the fintech product, if you like. So it has a similar technology. It's like a super app, if you like, which you can download from the App Store. However, for those that don't have smartphones, we also give them access or provide access via WhatsApp, tablet, or laptop computer. So we believe that mHealth is the next big thing in mobile after mobile money. There are approximately 750 mobile operators globally, believe it or not, serving over 10 billion devices. And 250 of those networks serve the 2 billion population that I referred to earlier of people in emerging markets. Many of them are developing services to add to their supplement their primary income from voice and data services. Many of them are offering mobile money already. And as I say, we believe that mHealth will be next. We plan to license our technology to MNOs globally. Now, this is a highly scalable product. Our current attention, our focus, if you like, is in Africa, although we've identified markets in Asia and Latin America. And we're currently working on 3 markets where we're talking in discussions with the 3 major mobile operators in those markets. And I'd like to borrow a comment here at the bottom from the military, if you like, which made an impression on me, and that is that the MNO channel is a force multiplier for the delivery of mHealth services to millions of people in underserved emerging markets. So what are our objectives? We plan to be operational in 3 markets by the end of year 2, 20 markets globally by year 7, and we have an addressable market of 1 billion people. We're projecting 50 million subscribers globally, and we intend to position ourselves as the leading digital healthcare brand in underserved emerging markets. We're seeking $2 million of investment to roll out our first market, and we plan to use those funds to complete the design of our mHealth platform and wallet, establish our operational base in our first market, recruit additional team members, recruit doctors and suppliers, sign up distribution channels, marketing and sales, and working capital. So in summary, in addition to myself and our engineers, the engineering team, I have two very distinguished partners as founders in our company. Tim Elsegood, who is our Chief Operating Officer, has a host of experience in the healthcare sector worldwide, and Dr. Michael Anderson, who's a practicing doctor and is currently an honorary clinical senior lecturer at Imperial College in London.
So Robert, thank you for sharing your mission with us. I guess a few quick questions. What we're really talking about is how sometimes in underserved markets, they actually leapfrog established markets because they have access to technology and they're not fighting their existing infrastructure, right? Wired versus wireline in African countries is an example of that. They often had more advanced cellular networks than we had here in the States. What have you seen in your markets? And by the way, what markets are you in currently?
Okay, thanks, Jamie. We've tested it, our MVP in the UK. So our first market is either going to be Egypt or Ethiopia. We're negotiating in both those countries at the moment. Both of these are very big markets, by the way. I mean, in mobile terms, or population terms, they're in excess of 120 million people. But these mobile operators have 70 or 100 million subscribers on one network. So as I mentioned earlier, that's a great opportunity for us to use them as a distribution channel, if you like, through which to provide our services. And as you rightly say, I've been in this market a long time. The infrastructure is very slow in being built out, the fixed infrastructure in these emerging markets, particularly in Africa. And so therefore the mobile phone has become the de facto means of connecting to the internet. And the connection is rising all the time. In fact, the number of smartphones now across Africa on average is about 40% and rising. And within 5 years, we expect to see that up to sort of 60, 70%.